something done. And I also want to reiterate that I appreciate your time. I know you're all very busy people. So thank you for being part of this group. The informational packet from Cameron came through with some of the emails we got on the different subjects. And so as you look at the agenda, we're going to look at that today. What are the assignments? What do we want to get done? Who do we want to hear from that can help us make the decisions that we make? And that's who the special speakers will be. And then our next will be in 2 weeks, our next meeting. So with that, is Ann on yet? I know she's coming on shortly, but when she does. So who wants to talk a little bit? Is Mag Morelli on? Is Mag on?
Yep, I'm here.
Oh, there you are. Do you want to comment on the comments you sent?
Sure. And I wanted to send them ahead of time just to, to prep, because I think a couple of the questions are probably geared towards DSS. The first one was that, in speaking to some of our adult day centers, we were talking about the fact that DSS has informed us that the 1915I state plan amendment allows for certain people under age 65 to come to an adult day center. And many of the adult day centers, most of them, I think all of them maybe, and we're not aware of that. And one of the things that we thought might be an issue is that they're in the billing system for the waiver clients, but do they need to do something to get into the other billing system so that when someone comes to them who is not in the waiver but is under 65 and may be eligible, they know how to accept them and to bill DSS for those services. So I think we were looking for just some more technical information on how someone in the state who's covered with the state plan, just straight Medicaid, would be able to access the services and bill, and how the day center would be able to bill for them and make sure they're eligible and all of that. And the second issue was just, we were talking about sort of, is there going to be a woodwork effect? Is there going to be, how many people are actually going to come forward for adult day services under 65? Might it be a savings because it would replace other services they're receiving? And apparently there's a program, it used to be called the CBS program, and now it's called the Swiss program. That's what Dawn had told us in the follow-up email, where people under 65 in a different kind of program with the state were able to go to adult day, and adult day was able to bill. And so thinking maybe their experience would be helpful in determining what the demand would be. And then I know we got some information about the respite program, which I think was helpful. So those were our two questions, just trying to get to sort of the root of some of the original questions.
And if, so I didn't know what Swiss was or CBS, so I was Googling, I could not find it anywhere. And so I went to leadership at the Capitol, and they say Dorian is protective services for the elderly. Has that changed? I'm trying to understand that piece. Does anyone know Swiss?
Hi, sorry, good morning. What we had in our discussions with MAG and our executive committee, somebody had mentioned that the way that a client under 65 who had Medicaid would be able to come to adult day is if they were involved with protective services. So it's not where just anybody would, but if protective services involved with that individual, there is an opportunity for them to refer that person to adult day as a safety issue. And I believe there's also a limit on that, which, and again, don't quote me because I'm also not 100% familiar, Representative, but we were discussing it. And it seemed that there was a limit of, I think, $650 per month, which comes to like less than 1 day a week. So I'm not sure exactly of the rules, but I think that's the program to which they're referring, I think.
So I don't know if someone has more information on that, or do we add that to the list of someone that we want to bring someone in to talk about? And Mary Pat, you have your hand up.
I did. I guess when I was reading over the information, it talks about people under 65 meeting 2 critical needs. So that's one, protective services. What are the other critical needs that would qualify people? Is everybody aware of what those critical needs are?
That refers to activities of daily living, I believe. It refers to their medical qualifications. The protective services is, I believe, is actually separate. The two critical needs applies to people over 65 in reference to what I believe Dawn was speaking of, the entitlement from Mag's first question, is that people over 65 can access the program without the waiver. And so they would have to have two critical needs. I believe it refers to the medical necessity.
So my question on that is, are day centers aware that that is a population, or is this new information that we didn't know? Is this a population that we can, try to get involved in day centers?
I think, Chrissy? you
Yeah.
wanna answer that? Okay.
Yeah, sure. So as far as the membership of the association, we were only aware that people over 65 can access adult day centers through the waiver. From our meeting as a group last time, it was announced that anybody over 65 with Medicaid is entitled to attend. So if that's the case, that's exactly what you said, Representative, is exactly the question that Mag had posed. If there are means for someone over 65 to access adult day centers without being on the waiver, what is it? Because none of our membership seems to be aware of it. And then also that covers for over 65, not for under 65. The under 65, some folks were aware of. Again, that refers to the Swiss or protective services thing that we need to get more clarity on.
Right, we have to understand a little bit better. So do we want to invite Dorian Long to come and talk to us about it at the next meeting? To give us information? Do we want, does someone want to take the lead in this group to go out and get information on that?
I can ask her, Jane.
Okay,
I can ask Dorian because I've been in contact about the rates of reporting for protective services and getting those stats, the most recent, which they've gone up, which I'm sure you're not surprised, but
yeah,
we can-
that's great, Ann. That would be wonderful, and welcome. I know you have a full morning agenda, so glad
happy to
you're.
be here. I'm in the Capitol in our meeting room. Nobody else is here, but
Does anyone?
Representative Garabay, I see that Jen Cavallero is on. She took herself off video for a sec, so she might have stepped away. But she may have some answers for us. I'm not sure regarding the over 65 population questions.
Hi, Jen.
Good morning. How are you?
Good. How are you?
Very
Didn't
well.
mean to put you on the spot.
Not at all. Sorry. I may have missed what the questions were. I was a few minutes late in joining.
Yeah, I think you missed my my first question, and that was, and it may not be your question because it's people who are not on the waiver. But one of the, if people over age 65 with one or two critical needs can qualify just through Medicaid on the state plan,
Mhm.
how would a adult day center bill for that and pre-authorize that? Since most of them are in the waiver system and they bill for the waiver system, is there a different system to do it for someone who's just straight on Medicaid?
All right. It would still have to be done through the MMIS, but right, I think we'd have to check on exactly how to bill for that. So I will put that on my list here and check with our folks. And get
If
that.
you're an enrolled provider for the waiver program, right? So you're enrolled with, and you may not know this, but with the state to bill for the waiver program, are you automatically authorized to bill for all of Medicaid? Or are you specific to the waiver?
It would be specific to the waiver, correct?
Okay.
Yes.
So it may be require them the day centers to seek additional authorization to bill Medicaid.
Yes, that would be correct. Yes.
That might be the issue as to why people have felt it to be a roadblock to cover that these people weren't covered.
Right.
Yeah. Okay.
Yes.
So maybe if we can cross that bridge and get that opened up, that would be helpful. And what, it still doesn't hit the people under 65, that we're trying to reach, but it would help to expand to people who are coming in over 65 who may not be on the waiver.
Right, I think it's good to look at all avenues and, bring them all together and service as many people as we can in the different areas.
Absolutely.
So thank you for that. And then Margie, you also had comments? Is Margie here?
Yes, I'm here, Margie.
Margie, I'm sorry. I
That's
apologize.
okay. So yes, I know at the last meeting, some questions were asked about our program. So I just wanted to share that we do serve people under 65, just not a lot of people under 65. So we have very small caregiver programs. So it is an option, but the numbers were low, and we don't necessarily know why they're low. I had offered a couple of reasons. So again, it could be that they're not aware of the programs. It could be that they're not aware that they're available for under 65. So those were kind of some of the things that I was just throwing out there.
Okay, that's great. I know that, go ahead, Mary Pat.
I was just thinking, and maybe because I don't specialize in this area, my day services are more for the DDID population, but would it be helpful to everybody if we get some demographics? Because we keep talking about the under 65 and we don't know why there aren't a lot of people involved, and the over 65 that fall under Medicaid, those that don't. What if we were to get some statewide demographics and then maybe even drill it down to regional demographics so that we know exactly what we're dealing with and what areas we want to target? So just a thought.
To understand our population better, right? Know who's not, because my question was, what is the low percentage of people being served? What would those numbers be? What is the low percentage?
May I? Oh, sorry.
Yep.
I'm trying to get my little hand button, and for some reason I cannot. I'm sorry.
And I really feel that we can talk freely unless it gets out of control because we have so much excitement, but feel free to comment.
I agree with the comments from Miss Margaret's email, that it may be the fact that people under 65 are unaware that this service is an option for them. And it may come back to the fact that it's not known to be or considered to be or offered to them. So that may be part of the reason why those percentages is low. And then we had also had a question that we were going to pose, and maybe we need to send it in writing for a later follow-up, was that of the statistics she had sent, the 25% of the respite folks using adult day services. We were wondering if there's a number that's attached to that, out of how, is it a few thousand consumers, or is it, because I understand that the respite program might be limited. So we were just kind of curious in a way to get those demographics, what would be the numbers that kind of correspond to that. And then secondly, one additional comment in regards to demographics. Representative, you had asked us, or I think you'd asked for us to provide a map that shows the locations of adult day centers in Connecticut. And if you'd like, at any point, I have done that. It is a map that shows the regions of Connecticut with the listing of our adult day centers. And then unfortunately, I'm not a technological genius, so I have handwritten and then scanned the locations onto the map. So if that's helpful for anybody, I'm glad to share that or email that to the group. That was it.
That's great. So what I'm going to ask is, even like the comments of the past week through email, the sooner you can come through any time with anything, but if you can get that earlier to Cameron, our clerk, and he can compile it and have that all out to go out. So things like that you would send to Cameron and he can put it all together in a packet, and that would be helpful. Cameron, can you have it there, Chrissy? You're muted.
Sorry, I will send it to Cameron right now, and then he can have it for available whenever you're ready.
Right, and just,
Thank you.
and
Sorry
he
about
can
that.
put it up now. I'd be very curious to see where they are. Great
Sure.
work, thank you. Cameron, do you have your hand up?
Yes, guys.
Nope,
Thumb-
I was just giving a
Or a
thumbs up
thumbs
to
up?
that.
Okay, thumbs up, sorry.
Can I follow up on Mary Pat's comments? Because I think the key data piece, and I don't know if we can get it, so there's the question. The key data piece is how many people covered by the state, by Medicaid, under age 65, have one or two critical needs, right? Because those would be the people that would be eligible for the adult day if we removed that age barrier or we lowered the age barrier. And so, but I don't know if the state has that. It's the critical need piece that I don't know if the state has or not for the Medicaid population, you know, and a needing assistance in daily living. But assuming they do, and that's why they're on Medicaid, we can also maybe, and maybe Jennifer, you can help me if I'm going in the wrong direction here, assume that they're accessing other services. So this would maybe possibly replace or augment other services, you know, if they have someone who's, you know, a homemaker companion or someone who's coming in, and, you know, would the adult day be something that would be sort of be included in whatever services they're obtaining, but not necessarily adding to, you know, it might replace something or ease their use of the homemaker companion while they're going to adult day. I don't know. I'm just, you know, we can't just assume that if they go to adult day, it's a new cost. It might be a substituted cost. But does DSS have, I know for the waiver clients they do, because everybody goes under they get, you know, evaluated. But I don't know if anyone, people who just qualify for Medicaid have that.
Right, we wouldn't necessarily have done an assessment, right? We know their critical needs based upon doing that assessment on them. So we wouldn't have the data if we've not performed an assessment. That's where we're aware of their critical needs. So for anybody on the waiver, certainly we would be able to identify how many critical needs they have, but I don't know that we would be able to capture that data for those.
Right, so we might be able to, is what you're saying, but you're not sure.
Right, I don't necessarily know that we have a platform for that. But we can
Right.
ask the question.
I know oh,
I would think through MAPOC, we should be able to get that sort of dashboard from Key or somebody, you know, from Medicaid. Because my experience with the adult day program is that the critical needs are often around supervision because of wandering and safety, you know, fall and safety risks, you know, like not necessarily dementia, but some kind of thing that
Right, behaviors or.
behavioral, yes,
Hmm.
behavioral risk, sure.
Mhm, mhm.
Hi, excuse me, sorry. At some point in our conversations, Mag, you might remember, we meet monthly with DSS, with Jennifer and her team, which we are so appreciative and is very helpful for our association. And at one of the meetings we discussed with Mr. Paul Chase. He had some data that did speak to potential populations with critical needs based on, Mag, jump in, based on services that they were currently receiving that have the same need. And these folks are receiving, I want to say, home care or are potentially nursing home certified. And those are the folks that we could potentially offer adult day service as another personal choice, as another option, and as a more cost-effective option than the services for which they currently qualify. And it might not capture everybody but we're talking about, but I believe that it was Paul that had at some point pulled that information from somewhere. That doesn't sound as helpful when I say it out loud. So thank you. Sorry.
It's sort of using the data of the services they're using as
Yeah.
opposed to their assessment, right?
It was based on
Based
people
on services.
getting services right now, that if we offered adult day as an additional option, it would be cost savings for the state, and it would be an option that meets their current qualifications, medical need that they have right now. That's what it is. Thank you, Mag. Sorry.
and do we have access to the information of how many of the people that go to adult centers are being able to stay at home, that it is actually real, that if they did not have this service, they would be in a nursing home. I mean,
Right.
that's a reality. So by finding a way to service more people will save the state a ton of money through the nursing homes, I think. And I don't have your experience, but that just seems, do the day centers keep track, have those conversations? Can we survey some way? How do we get that information?
We could work with the membership to get some real information on that, some real data. We've actually been working with our executive board, has been speaking about starting data collection. And we actually did speak again with Miss Jennifer and her team about combining efforts on getting some of that data. But for specifically what you're asking, Representative, maybe we could survey our membership. And we do keep medical records on everybody, and it might take us a little time to get the response from everybody. But Mag, Cheryl, what do you think? Do you think we could get that information from our membership based on current census?
I definitely think we can get that information. I think that almost all of us hear the story from the people that we come into our centers to meet with us. My mom is currently in rehab. I don't want her to stay. I want to bring her home. What can you help me with? And I think that our membership can get that information. It's what we do.
Yeah, I would think that as part of that is in your intake, right? But
Yeah.
maybe since things have changed, but yeah, for sure. It's already it's about aggregating what your intake, because a lot of these are working families and they just can't leave their loved one home alone.
Right, and their level of care is nursing home level of care, correct, Jennifer? Right, to be in the waiver, sort of?
Right. I mean, certainly for those on the waiver, you could definitely correlate that, right, to avoiding institutionalization. I think the other data you probably could correlate to is reducing hospitalizations, right? Because you are able to assess individuals who, might be at risk of hospitalization by, catching something sooner and being able to, make a phone call to a physician.
Right.
That's absolutely right. We do that on a regular basis. Our nurses are screening people, calling, getting a doctor's appointment, and oftentimes our vans take the person to the doctor's appointment, all preventing where if they were home alone, it would eventually be an ambulance call.
Right. And these are conversations we've talked about, right? I mean, having, somebody in the home, they don't have a nurse in the home, 7 days a week. When they're, at an adult day center, they have access, to a nurse. A nurse has eyes on them. So that's, another, wonderful, benefit, which of course is, reducing, hospitalizations, which we know is going to, tie into value-based payments coming up.
Right. And there's also the human aspect of it. Instead of staying home alone in a home, whatever, they're at a day center being enriched with all these, wonderful things. I mean, I only know the one Cheryl runs, but when I go in there, they're doing incredible, growing their garden, eating their veggies. They're doing all these wonderful things. So, that's great.
The other thing that we look at is medication administration. We have, a huge confidence that for the time they're attending, their medication is being administered properly. We have no confidence when the person is home alone.
Right.
Right. So reduce the risk of medication errors.
Right. And would you mind making a list and coordinating all this information and who's leading it up, what is the adult day services, what information they're getting, and kind of coordinate that?
Sure.
That would be awesome.
Sure.
And we can have that hopefully for the next meeting. Anything else?
I just wonder if it makes, it's so hard sometimes to gather 100% information from your membership. I just wonder if we're really looking at the Medicaid population, if DSS is able to put together some kind of report, if we give if we think about the list of criteria, I mean, I know those that are getting home health at home, those that would be getting non-medical home care at home. I think that we really could gather that straight from DSS, don't you think, Jennifer?
You're
I'm
muted.
Sorry, yes, I know. Where's
Okay.
my T-shirt that says I'm muted? Yes, we certainly know, the dollars that we save by those that are on waivers, and I'm sure we could break it down by service category.
And I thought it would be great to have from both venues. It's a little bit different. So if Cheryl's also willing, I think information from both would be great, different kinds of information to do that.
I just want to chime in. I did have from previous work a link to the National Adult Day Services Association cost effectiveness fact sheet that breaks down some of the cost effectiveness to give a national perspective that perhaps could help as we gather state data, orient us to where we fall nationally or lead us to some national adult day center best practices. I'm not sure if perhaps Chrissy or Mag, if anybody knows if there's been a refresh, because I believe the cost effectiveness fact sheet was 2015 that I have. So if I put it in the chat for everybody, but that might.
There is. That's so helpful. Thank you. Actually, we have, and we presented at some point, so I can pull back up the Genworth cost of care study, and they do it every year. The most recent numbers have already come out for 2021, and I've submitted 2020. Actually, when we were in session, we were in our testimony, we submitted the 2020 numbers. I can get the 2021, I believe. And it actually does. I think this is the same link. I don't want to click on it because I'll lose you guys on my screen. But what it does, it shows the national cost effectiveness, and then it goes state by state. So you can actually click on Connecticut and see the cost of home care for the same 6 or 7 hours a day, the cost of a nursing home per day, and the cost of adult day services per day. So I can.
Can you email us all that link?
I will.
After the meeting?
Yep, I just don't want to lose you guys. I already lost my feed once, so let me see if I can.
That's why I'm not going to go in either.
Thank you.
And I can also provide in the link that OPM puts together a cost of care document every year that's updated every April. That breaks down by home care agency and nursing home agency. I can't remember. I don't think we have adult day in there, but it can break down to orient you as to the cost of care in our state by service type. So I'll put that in the chat too.
Okay, that's great. Is there any other information that we need to collect? I think I would I know in my conversations with Cheryl, and because I see it here in my town, it would be good for us to know, we did talk about, how is it being promoted or how is it being communicated to the public, whatever. And I know a ton is already being done. I don't know if it's the same throughout all day centers. But what you do now, like going out to groups, I know Cheryl goes out to groups. The town does social media about the adult day center and their activities. Facebook page, but we had that conversation at the last meeting. Do you think that's Chrissy?
Yeah, sure. Another thing that we've been working on, you're absolutely correct. Most centers are doing full-on marketing campaigns, outreach to their communities, just like what Cheryl does. She does a great job of making her town and community aware of the programs. We're also working with Jennifer and her team on a training piece to present to the access agencies. And this is just a 3 or 4 minute presentation that describes adult day service, its cost effectiveness and benefits. And it's something for access agencies to provide to care managers, because care managers are the ones in the waiver program that are working directly with the consumer and helping them to arrange services within their budget. And so we're very lucky to, like I said, to be working directly with Jennifer and her team, because they can help us to disseminate that information. So our group is working on that presentation right now. I believe, Cheryl, I think it's going to be ready for next month. Yeah, and we're going to be hoping that that will make some of the access agency care managers more aware of our service. After the pandemic, we found that a lot of access agencies, care managers were new. There's a lot of turnover. There's also, a lot of them have a huge caseload. So they're constantly working on getting services in place for their consumers. So we think this will help to show what a great option and choice it is.
Right. I think if we understand where we're at, you know, and what's happening now, it'll help us to understand what we need to do to give more access to people, different ages also. What else do you think that we need to understand to move forward? Anne, did you?
I think we touched on this in our organizational, but we're really going to be looking at the barriers to access around transportation and getting our folks there. That to me is the biggest barrier. I mean, we want to address cost, obviously, and we want to address ways to pay for it, and whether we want to look at as a state of subsidizing some of these home-based services. But transportation is, in my experience, the number one barrier.
Right. I've heard from Cheryl. Do you want to comment, Cheryl?
One of the things that I would like to say along with that is with the reduction in some during the pandemic and a little prior in the number of centers that we now have, we get calls from even further out, which makes not everybody can transport even further.
Right.
I get calls from places where there used to be centers closer to their location and are no longer. So yes, looking at those barriers and how we access transportation and the huge cost due to the price of gas increase, the catalytic converter situation, and just accessing staff to be able to drive those buses. All of those are so necessary for us to take a look at to help our centers.
And how far out do people come, like to Windsor? Do people, if they have one in their community, still want like a long-term care nursing homes? Sometimes people don't choose the one in their own town or nearby. They want one that's different, or the care's different, or whatever.
So in the greater Hartford area, we have probably like around most of the bigger cities in the state, we have probably a few more than in more rural areas. It's about the fit of the program for the individual and if they're able to drive. In a lot of cases, if it's an elder person with an elder caregiver, they're not as readily able to drive the further distance to that program, or maybe they don't even drive at all anymore. So it is difficult in that sense if it's an area we can't get to, or it's not cost effective to go to.
Yeah.
I have people, if they have individuals who can bring them, they'll come from far. I'm servicing a woman right now who works in Westbrook, travels to Hartford to work, and brings her mom on the way. That's a huge amount of driving. She's coming by anyway. I could never have picked her up.
Right.
I chose this program.
So I'm just going to suggest that our next meeting kind of focus on that first tranche of issues around the, Medicaid, and we'll get Dorian maybe to meet. But I do think we need a little bit further out our needs mapping across the state. And that's going to be more difficult to assess because who isn't coming to us is really hard to find out and why, right? But that's kind of those gaps are what we're this working group is tasked with looking at. So I'm wondering if we have suggestions on how to do that needs mapping.
Does anyone know?
I did send the map showing the adult day center locations to Cameron.
Yeah.
And I think once you take a look at that, you will see quickly that there are large chunks of the state of Connecticut that have no programs. And that's going to be part of it. We do have, I constantly get calls from people that are maybe 30, 40 minutes away that want to know if we'll come and pick them up if we can. I have at some point had my van go at least 35 minutes away from Bridgeport to East Haven. We've gone northwards towards Danbury. Again, I'm not actually from Connecticut, so I'm not as familiar with the geographics. But when you see the map, you'll see that there are huge parts of Connecticut that don't have programs. And I know that we would love to be able to expand, but being that we are currently in the most need of expansion within our current centers, that is a challenge. Also, it might note too that there were programs that have closed. I was looking at the Connecticut Association membership listing from 2016, and there was 52 members. Right now we have 36. And that's all programs that have closed. I know a big chunk of that came from a few national groups of programs, particularly like Active Day and a few others. And I know that their reason for closing in Connecticut only and staying open in other states is directly related to approvals and access for people on Medicaid. So those things we've seen, and it may help to look backwards at some of that information to see where the needs have been and would be in the future, if that's helpful.
Well, it went from 52 day centers.
In 2016, 36 we have. We actually had a program closed during our last meeting as a group. While all of us were on the screen, when we got off the screen, we had an email from another program that closed. And it's, I think they've been open for quite some time. Cheryl?
30 years.
Do we know what the reasons are for closing? Is it the low enrollment? Is it the reimbursement rate, the not having staff?
A and
All
C.
of the above.
All of the
All of
above.
the above.
A and
Yeah,
C.
okay.
A and C, the reimbursement rate, we're very grateful that our reimbursement rate has been increased.
Yes.
We're grateful to everybody on this call, to DSS and to legislature for helping us to increase our rate. So we're very grateful for that. But again, it's enrollment. We need to expand and be able to take in more consumers.
Well, that's where,
Sorry.
I'm sorry, go ahead.
The increase to the reimbursement rate has truly been wonderful, but just if everybody on this call just thinks about every month, how much your food bill has gone up, how much your gas has gone up, how much everyday living has gone up, staffing, everything. Thank God for that reimbursement rate. We continue to have those struggles that we are all feeling to the cost of living right now.
Mhm. Mhm.
Right.
You know, it's interesting to hear that you have low enrollment because on the DD side, all of the providers are struggling with wait lists. You know, at the Kennedy Center, I've got 45 people that we were serving prior to COVID that we haven't been able to bring back yet because we don't have the staff, right? So I don't know. I'm part of my interest is as we're going down the path is to look at where would it be appropriate that some of these day services could be combined, especially in areas where there is not enough adult day services, but there may be DD providers in that area. And so, you know, that's why I was curious about the waiver and the requirements, and are they somewhat similar? And is this something that could, you know, work together? Not all DD programs would be appropriate for seniors, but there are plenty that would be appropriate. And there's plenty of seniors who have DD that are looking for programs, that are on a waiting list for, one of our programs. So is there some work that can be done together? And everybody's on Medicaid, so that's already done. Something to think about.
Would these be clients through DDS?
Yes.
So some of our programs are DDS providers. We are, my program is actually registered as a DDS provider. We don't currently have any DDS clients. And I know that, and it's definitely, this is something you're absolutely right, we should look into more. But I know one of the challenges is that the DDS requirements for a provider are more extensive than the standard DSS requirements, including things like pay rate. So if, and this is just an example, I'm not an expert, but I'm just throwing it out there as an example. Prior to COVID, we did have 2 DDS clients, and in order to meet the requirements for DDS, their minimum pay rate, I actually had to give a raise to 4 of my staff members to make sure that they were within the minimum requirement from DDS. And after COVID, I believe that rate went up, but I'm not 100% sure because those 2 clients, there was only 2 clients, and actually they did not return to the program. But that's just an example. So, but I think it's definitely worth exploring because this is what we want to be able to help as many people as possible. And if there's folks that need service, it might be a good option.
I think we have to look at all the areas. It's like juggling, and we need them all for it to function.
What I see in having worked in both settings is that some of these umbrella campuses certainly have capacity or could have capacity to support what I call peer specific. Like, the seniors want what they perceive as their peers. And younger DDS people want their peers, like they're so all in the same room may not be what they want, but on the same campus where there's the overhead is shared, where the administration is shared, where the payroll, the human services, that especially when we're seeing more emptying of commercial real estate and empty spaces in these corporate, no longer used headquarters or whatever, because much more work is remote. This is not remote work. This will never be remote work. That's the whole point. So we
never was.
Exactly. So we could be a very attractive tenant to spaces that could be flexible to serve different, I'm going to call them peer groups, like we know from the back end what the DSS and Medicaid, whatever, but on the front end, especially when I'm showing families the program, they're very much centered on, do I belong? And so from that forward center, maybe over here you belong here, maybe over here you feel like you belong here. That's where I see some real, some real synergy to and to sort of rebrand to the community this service, and also ways maybe the state could support again those overhead costs or some of the infrastructure costs to making that available, and transportation costs.
Right. So collaboration, that's what we want to see, how we can collaborate to do more. So how would we go about doing that, Anne? Or Mary Pat? How do we get more information? Who are the people that we would contact to try to understand and come up with a plan of how we can collaborate? How do we make that an action?
Good question.
I know. Anybody, I mean,
No, there are definitely folks within DDS. There are providers. So I'm here also representing the Connecticut Nonprofit Alliance, the DD division. And so I have access to all of those folks to be able to talk to them and, you know, to see who, again, this is why I'm interested in like what areas don't have programming and what are the reasons there isn't programming and why aren't there wait lists like we have, you know what I'm saying? So what are the reasons people aren't going? So I want to get some more information, but there certainly are people to reach out to and go back and have these conversations with. I think also DDS right now, I am not on the day services work group, I'm not on the residential, but for their ARPA funding and what are the future plans for that money. We can find out who's spearheading the day services group and be in some communication with them to see what their plans are. You know, the overall DDS plans are for transformation of services right now. So really everybody is looking outside the box at how things can be done differently, right? So this timing, you know, timing's everything. And this might be the way to go. So what I'll do is I'll reach out and find out who's spearheading that committee. As we start getting more information, I'll start talking to, you know, some of my associates and we can, you know, see what's out there and what people might be interested in doing. But again, it still gets back to that challenge of staffing. And yes, like Chrissy said, if you've got different rates and different pay for your staff, you know, that's something that would have to be looked at. And, you know, doesn't make a lot of sense to me how if you're working for a DD provider, you have to start at $17.25, but if you're working in adult daycare, why aren't you starting at $17.25?
Yeah, we need to raise the floor for
Yes.
these services in a workforce shortage. And there is a huge workforce shortage and it's spread out, you know, across the healthcare sector. And so I see the only way to address that is raising that floor so that it's, you know, so that.
And why isn't it consistent?
Right.
Right? You know, why, you know, this gets back to MedCert, gets back to so many different things. You know, why is DDS different than services under the DSS versus DCF?
Yeah, and then, you know, it's historical and some of the rate increases have actually been tied to the minimum wage as opposed to a different wage, you know, so the adult day centers have received increases, but to sort of compensate for the minimum wage increase. But I think you're right, it's an information issue. Mm-hmm. And as Chrissy said, not everyone is trained or equipped to care for the DDS population, but some are, and there may be some that would be willing to do it. So maybe it's just a matter of, you know, going to the Alliance, having discussions, having someone from the Alliance come and speak to the adult day centers. Maybe there's a center that would want to expand or could expand. Maybe there's someone who wants to create an adult day center from the Alliance, and then the Adult Day Center Association could help them to move in that direction. So I think you're right, Mary Pat. It's information is so critical, and I think it's upon us to sort of reach out and start sharing information.
And the other thing that, you know, DDS is struggling with, and a lot of providers are struggling with, is that the population that we serve, many are seniors. I mean, just at Kennedy Center,
yep,
over 50% of those in my group homes right now are over the age of 60.
Yep.
All right. Years ago, people with developmental disabilities, many of them did not live to see their senior years. They are all living to see their senior years now. So they don't want to work anymore. They don't want to go to the typical day program. They want to do senior, you know, they want to relax, you know, they want to be retired. And so why not? That's like kind of the natural progression, and to still be in the community, which is the ultimate goal, is that everybody's still part of the community. But I think we have to recognize that the DD world has a very large senior population.
Yeah, and they are needing critical medical needs sooner, you know, and they are getting Alzheimer's at a really high rate. But one of the things that, just as you were talking, if we reimagined adult day hubs, and then we could reimagine transportation, because look at how many vans, look at how many wheelchair vans are coming into the Kennedy Center to pick up their people. What if we streamline the transportation
There
to
you go.
the hubs of adult day centers, but still customize and tailor those spaces to the needs of those individuals?
Yeah.
I think
Well,
the
again,
workforce is important also when you're talking about the workforce. And I work a ton with businesses of all sizes in my life outside the legislature. And I'll give 2 examples. We have one company that's a manufacturer of air and cooling systems for airplanes. They were in dire straits like everybody else. So they set up their own training program. They're paying a living wage. They promote and prepare people to move up the ladder within the company, and they cherish their employees. They are booming. They don't have problems. Then I'll compare 3 restaurants. I have one that complains all the time, every time I walk in. Oh my God, you guys made, you know, your minimum wage, $15. You're ruining my business. And he complains and he has trouble with his employees, etc. There's 2 other restaurants that have kept the same employees for years and years and years. They pay them well. They work with moms to have time off when they need it. So building that caring situation and being able to pay a decent wage goes a long way to finding employees, I think. Not the whole thing, but a big part of it. So.
Yeah, and I think back to the transportation, I think that collaboration is a great idea, but we seriously have to look at the rates for reimbursement for transportation. Here's just kind of a example. So for our big buses to go out and pick up people, bring them to a program, bring them home, on average, we get about $5 a trip. Now, that's not a lot. But for others who we can't provide transportation for, DDS is reimbursing those individuals to take Ubers at as much as $25, $30 a ride. I don't get it, right?
How much does something like that?
The Uber could be up to $25 a ride.
Yeah, and
versus the $5 a ride that you get because you're using a van, or $5 because I have staff driving their car and picking somebody up on their way into work.
And then they're getting mileage, but that's, you know.
But even like Nutmeg Rides, which is a nonprofit up in my area in Northern Connecticut, they charge $7 for a ride like to church. They provide people for just rides to different places. So $25 is ridiculous.
In adult
It
day
depends on how
centers,
far they're going. I'm sorry.
Right, ours is within a
no, that's
certain.
okay.
Right.
Adult day centers, we don't get reimbursed for the transportation we provide. It's included in our rate.
It's included.
So we get nothing for the vans that we send 20, 30 minutes away. And I don't mean nothing because our rate, again, we're very grateful to have a rate, but we get paid, approximately $86 for a medical model for the day. And the $86 covers cost of the nurse, the cost of the building, the cost of all the other staff. It would have to include the increased rate for staff for if we did have DDS clients. It includes the breakfast, the lunch, all of the activities, the personal care, CNA, and it includes 2 trips in the van. And as a adult day provider, we're required to either provide or arrange transportation for our members. So Cheryl described an example where somebody's family member brings them in. That's great. But if she wanted to take that member and the family member can't bring them in, it would be up to Cheryl to either pay for the transportation or not be able to take that client. And some programs, my program's very lucky. We do have 2 vans of our own. But some programs have to contract out transportation and they're paying between $15 and $20 per person per ride. And we get absolutely no reimbursement for that. It would be, that's another reason why this conversation about transportation is also very important.
Right, that's key.
So I would just like to explain that being a medical model and we help to arrange for our clients sometimes with doctor's appointments, et cetera. So if we have a Medicaid client and they're in our program and we help to arrange transportation, they are provided transportation. Someone will come, it's paid for, pick them up from our program, take them to the doctor and bring them back. But yet we bring them to and from our program with no reimbursement. And that's a big part of our medical model programs. We are the nurse there every day. We are the CNA every day. And that transportation piece is huge for us.
Yeah, and I don't want to
Thank you,
build
Lori.
on, but it's door-to-door transportation. It's
Oh,
not
yes.
curb.
Thanks, Mag. It's door to door,
Door-to-door.
hands-on.
Yeah, that
Yep.
means actually helping. So if you send the van to pick somebody up for a doctor's appointment right now that the state would pay for, they wait at the curb for the person to find their way into the van. Our drivers actually have to physically assist people on and off the van. They have to, they do the whole 9 yards into the program. They don't just open the bus door. So
Right.
it is a full service. Thank you, Meg. And thank you.
It's also it's a valuable service because, twice a day, someone's got eyes on that, at least the part of where this person's living. They get a sense of what's going on there. And, they can, every day they know what's going on there. And so they know when there's a change. So it's costly, but it's extremely valuable to have that extra service.
That's a good point. In my early years, when my kids are small, I drove school bus. And you learn a lot about kids and their families with that transportation. It's just a natural thing that happens. So that's a really good point.
Our drivers have been first responding to people too as well. If they're scheduled to pick somebody up and the person doesn't come out or doesn't open the door, steps are taken. It's not something where a regular ride will just say, okay, Mrs. Jones didn't come out today and drive off. No, they have to take steps. They have to contact the office. We have to contact a family member, see what's going on behind that door and make sure that somebody didn't fall during the night and not be able to get up. And our membership could share with you stories of several times where the person didn't come out for the driver and it was because they had fallen during the night. We had somebody that had fallen and not been able to get up. During COVID, when we were providing a lot of remote services, the drivers were sometimes the only people laying eyes on those clients on a daily basis. And we have several stories, particularly, I'll quote just briefly one from the Juniper, where they had sent the driver to go pick up and send the meals delivery. And they knocked and knocked and knocked. And it turned out that the person had been on the floor for over 8 hours. Nobody had come for them. They couldn't reach the phone. So they did call first responders to go in the apartment. It's happened a couple of times. One of my drivers doing a wellness check, phone call and check, stumbled upon somebody that was in the middle of having a stroke. So the transportation piece is more than just a ride. It is. Thank you.
And just to piggyback on what Mag said about door to door, I mean, that's a question we get from families. Is there assistance on and off the bus? Because bus steps can be a little deeper. People, that might not be their usual routine. We have somebody at the top and I'm sure as everybody does at the top and the bottom of the steps to help people. So a very, very key piece to our program.
Okay, great.
I also add one thing, just in terms of what we've learned from home delivered meals, we acknowledge that the cost of the van, when you have your own van, the maintenance of that, the gas of that, so adding that all into what you're sharing about, the value of the transportation, all of that, but the cost itself to have the van to maintain that has been a struggle on our meal side. So we would acknowledge that is most likely a struggle for those of you who have the vans yourself and have to pay for all of that.
It's like you can have the best program ever, right? The best in the United States, but if you can't get people there to use it, so it is, it's very crucial. Glad Ann brought that up. So transportation, we'll put that on the list of things that we want to.
Yep, we just really want to elevate that, the importance and the, maybe the value, and it's been sort of an afterthought, I think, in terms of rates and, you know, reimbursement, but then with, you know, gas prices and so forth fluctuating, and you know, the costs of maintaining, like you say, those vehicles. That's why the idea of incentivizing these day center hubs and transportation, you know, maybe subsidizing some of that, it could be really, really attractive. For, again, we have a small state, we're not Texas, we should be able to map out these services to keep people in their homes and in their communities across our state. There's no reason why we can't do it, but we need to invest in it, and we need public funding investment, and that may be something that we want to talk to our federal delegation about as well. Yeah, it looks like everybody has to sign up for another meeting, including me. So
let's, we can kind of wrap up quickly.
Yep.
To do, but I'm so happy about the transportation. That's one of the first things Cheryl had mentioned to me, Cheryl and Chrissy, when we met that first time. And I had forgotten about it. So Cameron, I believe you have all the notes of who's doing what.
And I've got notes too.
And you've got notes, you've taken on a piece. So we'll put those out and do, you know, concentrate on those. As far as just quickly, any speakers that you want to have in future meetings? It can be just a small part, like 10, you know, even 10 minutes to bring in some information that we might need. Chrissy?
Yes, I agree that Miss Dorian Long would be very helpful, that somebody had mentioned. That's one. And then also we have one of the things we spoke about in the last meeting as well was the demand for services for people under the age of 65. And our association would be glad to arrange anybody that you think would be helpful to speak to that demand, because we know that it definitely exists. I've been now keeping track of our referrals for people under 65. I've had 3 from doctor's office, 1 from a nursing home in the last, just since our last meeting. And then lastly, again, I'll offer, if you'd like somebody from the National Association, when it's time and we're ready, I can have somebody there speak to how the Medicaid benefit works in other states to allow people of all ages to come to Adult Day. And also they can attest to the cost savings that the states have found by making the service available. And folks that have gone through the same transition that we're hoping to go through in actualizing that benefit for people. So they'll be able to provide steps and guidance to how they do
we
that.
Can learn from others. That's very good. Can you email me the name of the person that would be?
Sure.
And contact, and we'll put them on the list as one speaker. We have Dorian as another. Anybody else have someone they would like to have us invite?
I think it would be good to have a transportation expert when we get just really looking at that piece of it. And I know.
Who would that be, Ann?
Well, I was thinking we had Doug Holcomb on our special transportation task force that we did 2 years ago, and he was great because he's like a sort of a almost a savant about, you know, about transportation systems and so forth. I don't know, but let's talk offline about maybe when we get to that piece of it.
But it would be good if you could send to me and Cameron, and we put it on a list for us to have.
Perfect.
And then when it's time to reach out, Chrissy, you can, you know, but just so that we have the ongoing list.
Sure. Okay. I will do that. And I've already reached out to Dorian, so we'll see. Okay.
And we did say that the adult day centers would like give us an idea of how day centers in Connecticut are promoting themselves, what kind of information you're putting out, so that we can understand that. We don't have to have a big conversation about it. But just a few people have asked, you know, what are we doing? And I know you're doing a lot.
At
Anything
some
else?
point, Yeah, I'm sorry, it's Melissa. At
Yep.
some point, would we be able to maybe also have someone who utilizes adult day services or their family member just speak to, um, not only what it does for them and their family, but what position they think they might be in if they didn't have adult day to rely on. What did they do before? I would just like to hear a direct experience.
So would we want to dedicate a half hour of one of our meetings to just invite, several people to get a different idea, and we can leave, to invite them onto
Yeah.
the Zoom?
That'd be great. And I think it would be ideal. I don't know if it's possible, but to hear from people in different parts of the state, because I'm guessing if you live in the quiet corner, you're having a different experience than if you live in Hartford. So,
Right. So it'd be good to have, diversity, and someone from a city, someone from a small
Mhm.
town, north, south, east, west, because it's very different in the Torrington Hills than it would be, even in Windsor. So.
Yep.
We can reach out to our membership in different areas and arrange that. And maybe we could give each person 5 or 10 minutes from 4 different areas and let them speak to their experience.
Maybe we can lessen it to 3 and have more people.
3 minutes? Oh,
3
sure.
minutes is a long time. So, and I think if we could get we could get 8 people, it might be great to hear just from all different.
Yep.
Hi,
No
Ron.
problem.
We can get some
This was
family
helpful,
members
Meg.
and family members as well as members, because family members have a impact on their life as well. Sure.
Right, that would be great. That's a great idea. Anything else? Well, that's great. It'll all flush out when Cameron sends out the minutes. I think we've talked a lot and set some goals. If anyone thinks anything, after the meeting, send an email to myself and Ann, and we'll look at it and
Yeah,
move
hopefully
forward.
we'll keep moving forward.
It's
Very
exciting.
exciting. Very exciting.
Yes, because we don't want to lose more. So.
Yes.
Okay, so that was good. It's a good meeting. Everybody enjoy. We'll see you on the 22nd in 2 weeks. And if there's any
Thank you.
questions in between, just let us know. Any information you find out, please
Yep.
send to Cameron,
Keep it
me, and
flowing.
Ann, and we'll get it on the agenda and send it out in the packet. How does that sound?
Great. Thank you so much.
Thanks,
Thank you.
all.
Oh, thank
Thanks,
you
Donna.
all.
Good
Thank
to
you
see
all
you.
for your
Thank
time. Mary Pat, do you have a question? Oh, you were waving goodbye. Yes. Okay. All right, everyone, have a great day.